Okay, good evening and welcome to the Diabetes Remission program, exclusive to the Harrods Wellness Clinic. My name is Will, and I'm here with my colleague Reshma this evening, and we are very, very proud to bring you this exclusive program. We're really excited to share with you what is available and the vision for managing type 2 diabetes in a completely different way. Now, over the course of the next hour, Reshma and I are going to be talking through the team behind the Harrods Remission Programme, and we're going to be providing an overview of the programme before jumping into the details that include where the remission programme is held, the specifics of what is included, and also the research and the potential outcomes for the diabetes remission program as well. And we're also really excited to be able to offer an opportunity for questions for anybody that may be attending this session live. So, first of all, let me introduce the wonderful team behind the Harrods program. Now, we've been working together for a good few years on this, and we're really, really excited to be able to bring it to life. So to begin with, I'm going to hand over to Reshma to introduce herself.
So hi, I'm Reshma, the specialist obesity dietitian. So I graduated about 16, 17 years ago, and I've worked in nutrition ever since. So I did a good chunk of my career in the NHS, where I was supporting complex obesity and also looking at type 2 diabetes. And about 7 years ago, I started private practice, and I've been lucky enough to have the opportunity to actually open up my own clinic in Harrods, which we've been running successfully for 2 years now. For me, it was really important to take in everything that I learned in the NHS and bring it into private practice, figure out what was working, what was not working, and try and make almost a gold standard model to help my clients transition as well. So Remission Program was born between me and Will having a few chats and doing a podcast together. We finally decided we're actually going to put our expertise together and launch a program that we'll know will be life-changing for most of our clients that suffer with type 2 diabetes. Allowing them to go into remission was a massive, massive thing for us. So yes, I've worked tirelessly with type 2 diabetes and complex obesity, and I'm finally very proud to launch a program with a very good team.
Thank you, Reshma. And just to introduce myself, my name is Will, and I am a diabetes specialist dietitian. And over my career, I've worked in the NHS, I've worked in the private sector, and I've also worked in the non-for-profit sector for at least 15 years now. And as I mentioned, I'm a diabetes specialist dietitian, so diabetes really is my passion. And the reason that I love it so much is because I can see the impact that interventions like the remission program has on people's day-to-day life. It really is life-changing. And to get to be part of that is an absolute privilege. So I'm really glad that we get to do this together. Just a little bit about my background. I've written and implemented nationwide diabetes remission programs and weight management programs for the NHS that are still carried out to this day. And I've also written programs for local authorities. And these programs now support thousands of people with type 2 diabetes to achieve weight loss and remission of type 2 diabetes. What we're really doing with the remission program at Harrods is taking this to the next level. We're combining our know-how, our skills, our experience, along with the research to bring something that isn't really out there at the moment. In our team, we're also supported by Dr. Vasiliki Bravis, who is an esteemed consultant in endocrinology, diabetes, and internal medicine at Imperial College NHS Trust. Dr. Bravis specializes in supporting people with type 2 diabetes and has won many accolades, which span varying areas of research and implementation, and has won multiple awards celebrating her achievements. We're really proud to be able to work with Dr. Bravis to provide the medical oversight to the Harrods Remission Programme. And so, in doing that, we're providing a really safe program, but we're also bringing in exclusive insights and the latest in diabetes care.
Right, so I'm just going to go ahead and give an overview of what this program is. So it's a three-phase program, ideally lasting about 9 months. It's very individual depending on our clients. So majority of them will stay in the system for 9 months, but each phase can be tailored depending on the results they achieve, how quickly they're able to transition. So we have the reset, restart, and restore program. The good thing about this is you don't have to be London-based. You can be based anywhere in the world. At present, we're not accepting clients from the USA only because our insurance doesn't cover us to practice there, but anywhere else we can take on clients. The programs are offered in person in Harrods, as we mentioned, but you can do this fully remotely and virtually. We can get all the hampers and packs out to you. So wherever you are, it can be done. We will liaise with medical teams wherever it is. So as long as we have the details of where you've been looked after, where you're getting your medication from, as we transition in our program, we'll be able to communicate with the teams to ensure safety and safe transition of medications and the products that you're going to be on. So the first phase is reset, and this is usually for 12 weeks. And in this phase, it is quite medical, I would say, because although in general it's a holistic program, we do need to do a medical intervention to allow us to see how your body's responding to a change in diet and change in lifestyle. So for the first set, you will be on 800 calories of medically formulated total diet replacement products and meals. So whilst we're reducing the calories of the meals, we are still allowing you to get full nutrition because we're using medicated products. The vitamins and minerals have been added back in, and we're ensuring that you're safe on an 800 calorie diet. Your medication ideally will be reduced in this phase as per the safety protocol. So the aim is to get you to start reducing medications. And this is your diabetes meds, blood pressure, cholesterol, or anything else that you might be on that we think actually just doing a change in your diet and lifestyle can help you to reduce this. We do from the onset introduce behavior change strategies. So we'll already be talking about what's going to happen in the long run and helping you really understand that this is a short phase, but the phase with the biggest impact for us. So this is where we get the results in the initial part of it. And the other two phases will be where your maintenance actually happens. So 5 to 20% weight loss is what we're aiming for, and we know studies show that with interventions like this you can get really good weight loss just in the initial phase. As we transition from 12 to 24 weeks, we talk about the reintroduction of healthy meals and increasing activity levels. So we're really mindful that in the first phase, our clients are really doing something that's very textbook. We're telling you exactly how to eat, what meals are had, when to have them, and calories. In this phase, this is where the holistic approach comes in. So we're allowing tailorization of meals, culturally appropriate, talking about celebrations, how to drink, how to move. It really becomes a part of your lifestyle. So building sustainable habits is key in almost getting the results, but maintaining the results. What I found from previous practice is getting results is actually the easier part of it. Sustaining the results is what people find really difficult. Anthropometric measurements are really important. In the initial phases, it's very exciting because you come in at almost on a weekly weight loss and you see things changing. I guess when we go more into the maintenance phase, all of that balances out, but also finding what's a normal weight and what's a normal body fat and what composition belongs to you and what you can safely maintain when you're at home and what's realistic when you're traveling or celebrating, or whether it be Christmas or occasions. Like, how high do you go and what's your stop point? So we really find that out for you so you understand your body really well. And then the final phase is restore. So here we support with the longevity of your results and how we really make this a family approach. At no point do we want our clients to be, especially in the third phase, making their own meals or doing things different to the family. We want to integrate everything to make it really manageable and sustainable. There is continued education on diabetes and behavior change. So having a 9-month program just means we almost see you through every season nearly. And we do have an aftercare package as well, which we'll talk about. But seasonal changes are really important. Our food preferences, our activity, everything changes as the seasons change. So we really want to make sure that you know what Christmas looks like and you really know what, the summer months look like for you and how you behave. We'll continue with the testing. As we mentioned, not all the testing has to be done in the clinic in Harrods. We will teach you how to do this wherever you are. And also, if you're part of a gym, we can teach you what you need to look out for when you're doing measurements in gyms as well and how to do continuous monitoring. So remission is exclusive to the wellness clinic and to Harrods. So all our clients will essentially be seeing us in and around Harrods, or you will be Harrods clientele and you'll have this program open to you. For me, it was really important that we had the right setting for this program. And one of the reasons for that was a lot of diabetes services take place in clinical settings and people go into a clinical environment. I think with something like diabetes, there is a huge clinical element to it. However, most of our clients want to be nurtured and looked after. They really want to know they're getting a bespoke service, it's tailored to them, and there's no better environment to do it in a room that isn't clinical, isn't daunting, doesn't feel like you're at a hospital appointment. A lot of the conversations that I will have with my clients are quite personal. We like to know where you're traveling to, what your family preferences are, cultural, business, the amount of stress our clients are under, and most of our clients do live different lives. They are on flights, they're moving from one place to another. Travel is a big part of their life, but so is eating out and attending social occasions and functions and business meetings. So for us, we really decided that it would be appropriate to have it in a non-clinical environment. And even though we're doing something quite clinical in the first 3 months of our client's journey. And I think here you get to have an open and honest conversation to how people feel. These programs are quite invasive on someone's life. It's an investment into changing, which is quite uncomfortable for a lot of people. It's doing it with knowledge and empowerment to ensure that the clients get the results, but more importantly than getting the results is sustaining them. I've never had a problem getting results with clients. My biggest problem comes in the sustaining of those results. So I think the second and third phase for me are really important, where that intervention happens, knowing how to go out, knowing how to celebrate, but knowing how to come home and have sustained results.
So I'm going to talk a little bit more now about what remission actually includes. We've talked through the 3 distinct stages over the 9 months. But what is actually happening? What's included? What do people get when they come on the remission program? Well, it's really important to know that your remission journey is supported by your own dedicated consultant dietitian who is with you every step of the way. We also recognize that this is a team effort, and our team is always there in the background so that they can jump in and support whenever needed based on their specific skill set and experience. In our unique partnership, we are confident that we have all the bases covered. Over the period of 9 months, you will have regular appointments which are held face-to-face at the Harrods Wellness Clinic, and also via video calls and via app-based support. Each remission client also receives a remission hamper, which I'm going to go through now. And this supports people during their journey with remission. So to begin with, we have partnered with a company called Ultralife that produce the medically formulated soups and shakes, which are used as a sole source of complete nutrition. As Reshma mentioned earlier, these provide all the vitamins, all the minerals, the carbohydrates and proteins and fats needed to keep somebody healthy for a short period of time under medical supervision. We've worked closely with the team at Ultralife to develop this product and to ensure that it is the best on the market for this type of intervention. We've done lots of lab work. We've gone back and forth to make sure that it really is what we need and gets the best results. And in doing that, we know and we trust this product and this company to deliver what we need for our clientele. We also mentioned earlier that Ultralife, during the first stage, the reset stage, we have the soups and shakes, but we also have dedicated meals and snacks and meal plans if people choose to include meals during that stage. In the hamper, we are also using the latest in blood glucose technology to monitor and measure people's blood glucose levels continuously using the Freestyle Libre device. This is a fantastic product, and some people may have experience with it already, but this is beautifully powerful in observing and understanding how an individual's body reacts to the food that they consume, but also the exercise that they carry out. And with our expertise in using this, we are able to analyze it and give advice and support for that individual. In the hamper, we also include a blood pressure monitor so that people can monitor their blood pressures from the comfort of their own home. We know that with type 2 diabetes, quite often comes high blood pressure or hypertension. And we know that there is an increased risk of cardiovascular or heart disease. And we want to provide a holistic approach and make sure that we are covering not only type 2 diabetes, but any other health situations or issues that are happening as well in that individual's life. In doing that, we're also going to be taking regular blood measurements. And there's a range of blood measurements that we're going to be taking at key intervals throughout the remission program. And with these measurements and the monitoring, this is really all about safety. We want to make sure that this is as safe as possible for our clients. Now, with these blood measurements, these can be done in one of our many clinics around London or in a location of a client's choice. As part of safety, as Reshma mentioned, we're also going to be reducing medications at the beginning of the program. And the idea is that we don't bring those medications back because they will not be needed. But if we do need to reintroduce medications, we will do so in a timely manner to make sure that people are safe and healthy. And we'll be able to have that conversation and discuss options as to what is available to that individual. It's also really important to us that we stay in contact with an individual's existing medical teams. So we do provide regular reports and updates that can be used by existing medical teams to tailor other therapies that are running alongside the remission program.
So we've got the in-body scanner, and I think for me, it's really important that we use medical grade equipment to get some results. So if you are not here, we can locate the closest scanners in gyms or other clinics worldwide. If you are in Harrods, then we have the in-body and we also have Vectra that we can use to really identify the difference between fat mass, muscle mass, water, and your actual body composition. Now, the reason this is so important is because we're doing a medical intervention. In the first 3 months, it is likely that you will lose a little bit of weight from your muscle mass. Now, this will be halted in the second and third month. In the first month, if that's likely to happen, we're not too worried because we are doing a medical intervention. We're also looking for the fat mass to change. So using technology, we can actually see where the fat's coming off from and what changes are happening in your body. So it's important that we also educate our clients in knowing the changes that are going on and why medication may be reduced, but also if we're giving almost exercise on prescription and telling you to do particular exercise in different forms or lifting in a different way, it is to maintain the muscle mass, or it may be to get you into the fat burning zone. So using your results, we can tweak the program and also really help you with what physical activity you need to do as you transition into all the phases. If you are fully virtual, we can teach you how to take measurements at home. So that can be a regular thing. Every 4 to 6 weeks, we'll be taking physical measurements and also using scales that do some sort of body composition measurements so we can analyze trends and patterns as we progress. So part of your hamper will have your bespoke wellness guides. Now, the previous slide did show the nutrition guide, so we'll be telling you exactly how to eat, what to eat, how to make up recipes. Everything will be culturally appropriate, and we can really discuss family favorites or the restaurants you go to and how you're going to eat there. So nutrition, hydration, travel is going to be another big thing. I know most of our clients are traveling. They're not in one location, whether it be for business or for pleasure. And I think it's really important to realize that the program travels with you. You know, sometimes it might be a tough week, we go into maintenance, but for majority of the weeks, we will be looking at the weight loss element till we get the results we need. And we can tweak all of that to really make it bespoke. If you're flying to a different country, we can check out the hotels that you're staying at, the places that you might be eating, and be able to give you suggestions beforehand. We also have a lot of close contact with the clients, so they can WhatsApp and let us know where they are, so we can really tap in and keep it bespoke and as close to the program as possible. There's guides on sleep and stress management. I think this is really important because we know in diabetes, stress can really impact the numbers and the way we eat, the way we feel. So sleeping, getting routine, getting regularity is a big component of our program. Emotional well-being is another one. This can be quite emotionally taxing on some people. You know, they're really trying to get results, but they've got a whole life around them, and it's difficult to take the time out to really home in on, you know, this wellness program. So making sure that we're really in sync with how our clients are feeling, if there are any stresses in their life, how we can manage them with the clients, or just teach them techniques to bring more calm into one's life, just to make sure that, you know, you're really keeping your cortisol levels down and we're getting the results that we need. Movement and workout, I've mentioned this a few times, and I guess I home in on it a lot because a lot of people think that diet is the only thing that they need to change. Actually, physical activity is a huge component. At numerous points, we will plateau in the program. And when that plateau happens, it's not about eating less. It might be about exercising differently to what you're doing. Your body's really clever and it adjusts to what it's doing. So we're here to make sure that we override that cleverness to try and actually get the results. Based on your stats, we'll change things up. And also, if you're traveling, it will be different activity if you're at home and you have more time. Sometimes we want intensity with short timing. Sometimes we want a longer session, but less harshness on the body. So we really work that based on your environment and travel schedules. Recipes I've mentioned before, but we will be creating and making them bespoke to you. So if there are favorites, we can adapt those to say, okay, this is how to make it into a perfect meal, or this is the component that you need to have when it comes to vegetables, carbohydrates, protein, and the amount of fat. And as we transition through the program, the recipes too will start to change. So we'll be introducing different foods, different tastes, textures to really meet your needs. And then the exercise package, again, this is based on what you can and can't do. For some of our clients, it might be that we start the exercise, halfway through once we've really taken the nutrition, but it will be a holistic approach. So we expect all our clients to be engaging in some form of activity. Now, in the past, when I've worked, I've had clients who have been disabled and or bedbound, chairbound, and we've still managed to do successful weight loss by doing activities that are relevant to them. So regardless of your medical condition, we should be able to still administer some sort of physical activity using aids or whatever's available. So physical activity is going to be a big component.
We are also really excited to offer a lifetime open door policy. And we've done this because we recognize that with any long-term condition like type 2 diabetes, we know that there is always a chance that it can come back, even if somebody does achieve remission. And if it does, we want to be there to provide support. Each remission graduate has a lifetime access to this exclusive community that we have. And we continue to contact our clients after the remission program so that we can keep them abreast with the latest research. We know that research is happening every single day and we are learning more and more and more. We want to be able to bring the latest to people's inboxes, to their WhatsApp messages. We want to be able to have a quick phone call and give them the tips and tricks that are working. But we also want to update on the latest therapies and latest technologies that are coming out for type 2 diabetes. We know that this is an intensive program for 9 months, but we also know that the work doesn't stop at 9 months. But in those 9 months, we are going to be giving the tools, the confidence, the skills to be able to deal with life with type 2 diabetes in remission and for weight management long term. Now, next, I'm going to talk a little bit about the research, why remission is so important, really. And this is a real passion of mine, so I'm going to try and not waffle on about this. But just to mention, there's a few studies shown on the screen now. There is over 10 years worth of research flowing into the Harrods remission program. We know that for the majority of people with type 2 diabetes, this research has shown us that weight loss reduces blood glucose levels. And the research shows us that this happens by reducing the excess fat around the liver and the pancreas, allowing those organs to function again and to allow the bodies to manage blood glucose levels in the natural way. So we know that it's not necessarily about the fat on the outside, but it's about the fat on the inside. And this was really demonstrated in the latest research in the Retune study in 2022. And that showed us that even when people have a healthy weight with type 2 diabetes, if we can have a small amount of weight loss, it can achieve remission. So we still keep the weight in that healthy range, but we just slide it down a little bit. The main message that we're learning from all this research is that the more weight loss a person with type 2 diabetes achieves, the greater the chances of remission. But we know it's not only about remission of type 2 diabetes. We know that it is about so much more. It's about blood pressure. It's about high cholesterol. It's about joint pain. It's about being able to mobilize. It's about body confidence and general health and well-being. We know that this program is going to have an impact on every part of a person's life. As we mentioned previously, we are looking to achieve 15% weight loss from the starting body weight. So that equates to about 15 kilos or about 2 stone, depending on an individual's starting weight. But as I mentioned, we also know there's all these other benefits as well. But essentially, what we're looking to do is reduce blood glucose levels, reduce weight, reduce and eliminate medications, improve knowledge of managing type 2 diabetes, improve confidence, improve quality of life, and also improve a person's relationship with food. So that brings us to the end of our webinar this evening. If you do have any questions, please pop them into the chat. If you want to know more and you want to have a free phone call with Reshma or myself, you can email us at remission@thedietitian.com. That's remission@thedietitian.com. And you can have a personal one-on-one chat with Reshma or myself, and we can talk through what the remission program might mean for you.
Thank you, Will.
I'm going to stop sharing and I am going to stop recording.